Hi, I'm Elizabeth Makous, the Pelvic Whisperer. I'm a physical therapist who has had the honor and privilege of treating the pelvic floors of men and women for over 25 years. I have the Pelvic Rehabilitation Practitioner certification and I'm a certified lymphedema therapist. Today I will educate you on the use of Pelviwan's U-Wand. I designed it in collaboration with Pelvic Therapies for the primary purpose of helping men and women with pain that is best released rectally. To determine if the U is appropriate for you, if you haven't already, I highly recommend that you get a thorough medical evaluation and, if possible, an assessment by a specialized pelvic floor physical therapist so that you can learn the exact medical and musculoskeletal causes of your pelvic pain. Okay, having said that, let me introduce you to the U. Okay, I can almost see your eyes popping out of your head. And no, I am not crazy. This actually will be your friend. If you have pelvic pain because of a tight you-know-what, then this will be your friend and it will give you great power over your pelvic floor tightness. Before we proceed any further, I feel compelled to give you a couple of disclaimers. So please, no matter how tempting it is, please do not use this as a boomerang or a wishbone, because I promise you someone will get hurt. Okay, I'm trying to be a little lighthearted about this because really laughing is very helpful, and I like to liken the pelvic outlet as like your thoracic outlet. You see all these neck muscles here with arteries and veins and nerves running through it. Truly, your pelvic outlet is really no different. You can see all the muscles of your pelvic outlet, the arteries and nerves that run through it. And what do we do when our neck hurts? We get it massaged or we release it. And the same thing with the pelvic floor. It just needs to be released. So hopefully I've taken some of the craziness out of it and the weirdness out of it. All right, so let's get to know your friend. So this end of the U is much easier to use, so we'll definitely start with this. It has a knob, and then the angle of the curve I designed to be able to release the 9 o'clock to 3 o'clock positions on your pelvic floor. Now, how it looks here is if in a woman this 12 o'clock position towards the pubic bone is actually towards the urethra as well. So if you use the V-wand, the vaginal wand, to release vaginally, we recommend you stay away from that 12 o'clock position. But when you use the U-wand and you're going through the anus, there's actually several layers of tissues to protect the urethra. So if it's painful in there, it can be very appropriate to release gently. Now for men, this will help it. Since most of you watching is probably men because you're the most appropriate for anal release or rectal release. But here's how that looks. So when you go towards your penis, it'll be around the 12 o'clock position, and that's where you'll actually find your prostate. So if you start to feel any symptoms or referred discomfort or pain into the penis, you know you're on the prostate, and that is quite appropriate to treat sometimes gently, to release gently. Now, let's get to know the other end of the U. That is straighter and comes to a point with a little curve. This end I specifically designed to be able to treat the 3 o'clock to 9 o'clock positions on the pelvic clock. Now, that's what makes this U so unique because that's a very hard region to reach. So when you're using this, and we'll go over this a couple times because it'll be helpful, when you insert the U, you'll start with the open end away from you. Then you'll gently turn it around and you'll be able to take the knob end and just pull it towards you. And without much effort, you'll be able to release towards the coccyx or tailbone, where a lot of people do have pain. One of the biggest, a couple of really important things actually to remember when you're releasing anally, one of them is lube, lube, lube. And be slow and kind. Remember, we're releasing muscles that are already in spasm, and we're releasing muscles that have natural reflex to push stool out. So we have to overcome that natural reflex. But there are wonderful ways to do that, and that is, if here is your anus, you can take a lubricated finger, you feel free to glove your finger, and massage inward around the anal sphincter. When you do that, you're helping to desensitize the anal reflex. You're also helping to lubricate the anus. Now, this is also good for hemorrhoids, by the way, and a lot of pelvic pain patients, of course, do have hemorrhoids because you're in this vicious cycle of constipation and tight muscles. So this will help that as well. Now, once you have lubricated the anus, then you will be able to much more easily slip the U in. So once the U is in, then you'll need to find your hot spots. And I like to use the word hot spots instead of trigger points, because there's a complex of nerves and tissues and stuff. It's not just the muscles you're treating. It's a hot spot, areas that are painful. So once you're on that, you will be taking 15 to 30 slow, deep breaths, or more, however long it takes to relax that hot spot. But I find for my patients, it really helps them to be able to focus on their belly rising when they inhale and their belly lowering when they exhale. Rising when you inhale, lowering when you exhale. That way you will naturally recruit your autonomic nervous system into the process of relaxation. And once you release one spot, then you can release another spot. And if it's helpful for you to go to each number in the clock, then by all means do that. I wanted to point out as well that you may be worried right now thinking about, oh my goodness, what, how do I know how deep to go? Am I going to hurt myself? Well, I personally designed this to limit how deep you go as long as you move slowly. So when you're using the wand this end, you're almost like blocked. You really don't need to go that far. The pelvic floor muscle will kind of stop you. And also the knob end as well, you can insert that, and again, you're kind of blocked by how you reach, and you'll realize you don't need to go that far to hit your hot spots. So just move slowly, and the design of the curve should limit it. You just want to find those hot spots. Now we've come over to this side of the bed, because most of you will be doing this at home on your own bed. So make sure you prop several pillows up. And when you lie back, you want to find a position where you can really relax. In my house, the dog thinks that he's the pillow, so he would lay right here. But so whatever works to get you comfortable, support your legs. Now, what you're going to be doing initially is taking, when we talked about the lubrication of the anus, I want you to use one hand, and I'm going to use my right because I'm left-handed, so I'm going to use the wand in my left, but whatever works for you. The important thing is use one hand to massage and lubricate, and the other hand to guide the release end of the pelvic wand in. Now, of course, some of you might have bigger bellies or really long torsos, especially men, so if that's the case and you can't reach your anus, you might find it a little bit easier to reach your anus in standing first. You'll be able to find it, massage it, relax it, and then you kind of got to hang on to hold your spot. and then get in bed, lie back, and if you need another pillow if you can't reach, that's fine, and then you can insert the release end. Again, just to review a little bit, this end of the wand is going to treat your anterior pelvic floor, and when you're using the straighter end of the wand, you want to start with the open end away from you, insert it all the way in the anus. It has to go in the opening, and then you just lightly turn it, and I find it easier just to grab the knob lightly as you work your way around. Now, once you're here, you'll be able to pull the wand towards you with very little force, and you will be right on those posterior pelvic floor muscles. I want to give you one other trick that will be super helpful. When you withdraw the release end, whichever end, withdraw it very, very slowly, as not to trigger that reflex that we talked about. We don't want to set that muscle back up to be tight. This end, you may actually find it easier to withdraw if you turn it back away from you. So you just have to play with that. Releasing this way is going to be a little bit challenging, but remember, with practice, you will get it and it will be worth it. Now, you may be having some questions about, well, how often do I use the wand? Well, again, for my patients, generally for the home program, I'll probably start out with once a day. And of course, whenever it gets tight, and even before they know it's going to start getting tight, but that's not always possible because you have to be able to actually relax and lie down and take your pants off. So at least once a day, and then hopefully as you get better, less and less. You also may be wondering, well, how much force should I use? Well, what I have my patients do is when you're holding a hot spot, it should actually gradually get less and less painful. And then when you're done with treatment, it should be the same or a little better. Now, the reality is your muscle may flare at first. You may have some rebound pain, and within reason, it may be appropriate. You may not have to back off on your pressure. But the key is over time, those hot spots should get less and less painful, and then you should gradually see the rebound getting less and less. If this is not the case, please consult your pelvic health practitioner. So happy releasing. You are on your way to a healthy pelvic floor.